The Health Secretary said compulsory jabs for NHS staff would boost uptake among healthcare workers and protect patients. He said that care home staff are already required to get the COVID vaccine to work in the sector, with all expected to be jabbed by November 11th. But this has caused uproar in the care sector, which warns homes will have to close because they will not be able to find enough vaccinated workers.
So far, it's over, I think, 93% thereabouts that are vaccinated, people that work in the NHS. So there is around 100,000 that are not at this point. But what we saw with the care sector is that when we announced the policy and then we set it in law, November the 11th is the sort of cut-off date, then we saw many more people come forward and do the right thing and get vaccinated. And that's what I hope, that if we do the same thing with the NHS, we will see. It's about doing the right thing. I think that if we didn't do this, just think about that for a second. You would basically have people that are working in the NHS that haven't got vaccinated when they could have. Remember, people in the NHS and care were rightly offered vaccines right at the start when we first had vaccines. So if they haven't got vaccinated by now, then there is an issue there about patient safety. And that is something, of course, the government would take very seriously. That's why you'll find, actually, I think most countries in Europe have already done this.
Okay.
However, the Labour leader Keir Starmer disagrees with the Health Secretary and opposes mandatory COVID-19 vaccinations for NHS staff, as he fears it risks a lot of people losing their job. The Labour leader did, however, encourage all staff to get double vaccinated.
I think we should encourage all NHS staff to be double vaccinated and give them the support that they need. I wouldn't make it mandatory. I think that risks lots of people losing their job. We've got a crisis coming down the track for the NHS. It can be a very, very difficult winter. The last thing we can afford is for thousands of people to be pushed out of their jobs in the NHS. The regime that's been running for the last 9 months or so, my wife works in the NHS, is to be either double jabbed or take negative tests 3 times a week. That's the regime in our household, and that's worked very well for the last 9 months. So that's what I would focus on, rather than going down the route of mandatory vaccination.